Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good evening, everyone. I am Dr. Tanmoy Pal. I am a senior consultant neurologist working in Neutia Gateway Multispeciality Hospital, Siliguri. I have been working here since 2019, and so uh, uh, I am very glad to share this evening with all of you because in 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 the next few minutes I'm going to talk about epilepsy, which is a very important disorder in our practice, in our neurology practice. And unfortunately, even nowadays, there are a lot of misconceptions. There are a lot of myths regarding epilepsy, and which needs more awareness among people to know epilepsy more, and which would help them to get treated more properly.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, seizure uh, is an abnormal electrical activity from the brain. We know that brain is composed of the neurons. Neurons are just like electrical wires, electrical circuits, very complex electrical circuits within the brain. So, although how the seizure starts from the brain is a very complex thing, just to make a complex thing simple, that if there is the wires, the electrical circuits inside the brain, those are generating uh, electrical discharges all the time. So whatever we are doing, suppose we are trying to hold something, so there is a electrical discharge from a particular part of the brain, which then activates my hand to hold an object. So this is how the normal activity of the brain is done. So if there is an abnormal electrical discharge from the brain, there it would result in shaking of the limb. So this shaking of the limb because of this abnormal electrical discharge is called seizure. Now, seizure are of two types. One is focal onset seizure, another is generalized onset seizure. So, if the abnormal electrical activity comes from a particular focus of the brain, and then it spreads to the another part, other parts of the brain, then it is called a focal onset seizure. Now, if the whole of the brain is generating abnormal electrical activity simultaneously, so it would result in a generalized seizure activity. So accordingly, the epilepsy, there are two types of basic two types of epilepsy. One is focal onset, another is generalized onset.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So before I go into the cause, you first need to know that what is epilepsy. Epilepsy is a tendency to have recurrent seizure. So if a person is having a single seizure, that may not mean that that person has an epilepsy. A single episode of seizure, it can be because of low sodium, it can be because of excess of alcohol intake, can be because of low blood sugar in the body. So all these can lead to seizure, but those we will not stamp as epilepsy. Epilepsy means the tendency to have recurrent seizure. As per the definition, two or more unprovoked seizure activity. If the person is having two or more unprovoked seizure activity, then it is termed as epilepsy. So all the seizures are not epilepsy. So your question is, what is the cause of epilepsy? Now, cause of the epilepsy varies from age to age. Like whatever be the cause of epilepsy in the children may not be the cause in a elderly person. So here I would like to note a point that it's a common myth that the epilepsy starts from childhood only, but it is not true. Epilepsy can start in any age group. So based on the age, the cause can vary. Usually the genetic epilepsy, various syndromes, or birth defect in the brain, if the child had suffered some uh, uh, lack of oxygen at the time of birth, if the child had cried late at the time of birth, so all these lead to damage inside the brain, which might cause epilepsy later on. Now, in the older age group, epilepsy can be caused by a head trauma, leading to a scar inside the brain. It can be caused by any brain infection or a sequelae of brain infection. It can be caused by a stroke, or there are a few uh, not so common cause of epilepsy, but which are known as autoimmune encephalitis. So these autoimmune encephalitis is a burning topic nowadays. These are upcoming causes of a new onset epilepsy, but more or less, so these are the main reasons. Like one is genetic, one is birth injury to the brain, second is then there is head injury, stroke, brain infection. So these are more common causes of epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So it's a good question. Signs and symptoms of epilepsy, that the most common uh, uh, feature of epilepsy is having seizure. Like there would be vigorous shaking of the body, the patient would not respond, there can be uprolling of eyes, there can be forceful deviation of the head or eyes to one side, there can be jerky movement of the limbs, can be tongue bite, can be frothing. So all these are common symptom of epilepsy. But uh, a few people with epilepsy may not have these features. So even a very small uh, behavioral arrest, like the person is talking, suddenly he or she has stopped talking and staring vacantly, this can be a symptom of epilepsy. The person is having a frequent blinking of eyes or lip smacking movement like this, so this can be a symptom of epilepsy. If the person is having sudden onset abnormal sensation along a part of the body, this can be a symptom of epilepsy. So these are the rarer symptom. Oh, some person can sustain a sudden fall with brief loss of consciousness, very brief, for a few seconds. So these can be signs of epilepsy. So these are basically the signs. And one more thing I would like to mention, there is something called aura. So aura means the person who is having epilepsy might have the knowledge that he or she might throw a seizure soon. So some person with epilepsy understands that he or she might have a seizure within a few seconds or minutes. So these phenomenon is called aura. Aura is very important as far as the history is concerned, from a neurologist point of view, because if there is an aura, it always indicates that the epilepsy is a focal onset epilepsy, which I told earlier. And the treatment would also vary from if it is a generalized onset seizures or if it is a focal onset seizure. The medication that we choose for epilepsy, it varies.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, that's what I already mentioned uh, at the initiation of my talk, that there are a lot of misconceptions regarding epilepsy. In many population, epilepsy is still considered as a work of the god, or or some some worth from the past life. So these or in a few population, a person with epilepsy is regarded as some the person has been caught by a ghost. So these misconceptions are still there, and basically these hinders the treatment. The it has a big social impact on the person whosoever is suffering. He or she might um, avoid going to the doctor, might avoid disclosing their problems to the family members. And in our country, unfortunately, the females who are having epilepsy, they might come across some marital issues. So these we see in our day-to-day practice. So we try to counsel the patient and their relatives that there is nothing to be hidden. Epilepsy is just like another disease, say, just like high blood pressure, just like blood sugar. All these diseases, there is no permanent treatment. There you have to take regular medication, and same with epilepsy. It is just a disease of brain. There is nothing to deal with this what from the god or from the past life. There is nothing to deal with. It's just a disease of brain. If you get treated, if you take medicines, your seizures can be controlled beautifully.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So uh, the most important thing is the patient has to stick to the medication. The patient has to take medication timely and on a daily basis, must not skip a single dose of medication, because if you skip a single dose of medication, it might cause a recurrence of seizures, which can be even fatal. So you have to take your medications very particularly, and you have to visit your doctor at a regular interval. And for the caregivers, uh, they must ensure that the person, the near and dear one who has epilepsy, is taking medicines regularly, he is going to the doctor regularly. And the caregivers must know the sign and symptoms of seizure when the seizure is happening. So suppose one person is having a seizure in front of you, what you should do. So uh, if one is having seizure, you must not try to stop the seizure. You should first bring the person to a safe place to avoid trauma. Suppose one is throwing seizure at the middle of the road, he might catch an accident, or one is throwing seizure and because of the vigorous movement, the the limbs can hit any object and it can cause fracture. So you have to keep the surroundings safe. And usually most of the seizure stops within 1 minute. So you have to keep a record of time as a caregiver. If it is if the person is seizing for more than 1 minute, there is one spray that we the neurologist prescribe to all the epilepsy patient. It is called it, it's a medication. It is called a midazolam spray. So if the person is seizing for more than 1 minute, the the spray has to be sprayed inside the nostril so that the seizure is aborted. And one more thing, uh, the the subject who is having seizure, he has to be turned to one side, usually on the left side, so that the the froth or the saliva which is coming out does not go inside the lung. So these positioning is very important. This is called recovery position. You can google it, the recovery position, and see what is recovery position. Until and unless the person is regaining consciousness, the person has to be placed at the recovery position. These are the
Okay,
important points for
okay.
the caregivers.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So final thought about epilepsy which would like I like to convey to the society is that epilepsy there is nothing to be hidden. Please keep it open to your near and dear ones, and so that if you have a seizure, then the proper management could be done. And you must take your medications on time. You must visit your neurologist or treating the doctor timely. And you you read about epilepsy, and if someone has epilepsy, my my suggestion to the person who has epilepsy to treat to teach their near and dear ones about epilepsy. By this way, we can spread the knowledge about epilepsy more and more, and it would really be helpful for the treatment.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.